Is now starting. All attendees are in listen-only mode.
Hello, everyone. Good afternoon and welcome. Thank you for joining us for today's webinar, Educating Students About Opportunities in Healthcare. My name is Nicole. I'm the Education and Training Coordinator for the Florida Literacy Coalition. This webinar is made possible through the generous support of the Florida Department of Education, Division of Career and Adult Education. We would also like to acknowledge and thank the Florida Blue Foundation for their support in the development of this publication that we're going to be talking about during the webinar. Before we get started, I'd like to show you your controls. So if you would all turn your attention to your panel that's going to be should be on the right-hand side of your screen. On this panel, you'll see all the tools that you need for this webinar. On the left-hand side of the panel, on the upper left-hand side, you'll see a little hand icon. That's the hand raise icon. So if we want to get a quick poll or something and we ask you to raise your hands, you just click that button. So for instance, if you can hear me right now, go ahead and click that hand raise icon. So everyone raise your hand if you can hear me. There we go. Perfect. Thank you so much. So that's good. So it looks like most people can hear me. All right. Also, the red arrow key in that same location, if you press that, it'll dock your panel to the side. If you press it again, it'll bring it back out. Throughout the webinar, you will be asked to participate in a couple of polls. We will pop these polls up on the screen, and you just choose the best answer and submit it, and then we will share the results with everyone. It's a pretty easy process there. Last is the questions box. This should be on your main panel, and there you can ask any questions to Heather when she's going through the webinar. I will ask the questions to Heather, and we may stop at certain points to ask questions. So if you don't hear your question being asked right away, it will be asked by the end of the webinar. All right, so with that, I would actually like to introduce you to our presenter today, Heather Hepler Surrency. She is our Health and Financial Literacy Coordinator here at Florida Literacy Coalition, and she is the author of the Health Careers Guide that we just published. So with that, I would like to pass it over to Heather.
Thanks so much, Nicole. Good afternoon, everyone, and thank you so much for joining us for this discussion of how to implement our Health Careers Guide as well as additional health careers curriculum with your students. So I think most of you are familiar with the Florida Literacy Coalition, but I just wanted to let you know that we have been around since 1985, and our job is to promote, support, and advocate for the effective delivery of adult and family literacy services throughout the state of Florida. So we work with more than 275 now adult education, literacy, and family literacy providers throughout Florida. So we are here to serve you, and we really appreciate you joining our webinar today. So of the many projects that we work on here at FLC, we do manage the Florida Health Literacy Initiative, which is funded by the Florida Blue Foundation. So many of you are probably familiar with the publications that we have produced through the support of both the Florida Blue Foundation and the Department of Education, including our Staying Healthy curriculums, our Staying Healthy Blue intermediate book, as well as the Staying Healthy for Beginners, Coping with Stress, Women's Health, and then our newest publication, as Nicole mentioned, is Health Careers, a guide to finding entry-level jobs in healthcare. So just a little plug for the Florida Health Literacy Initiative. We are going to be releasing our call for grant applications beginning in the middle of December, and that will be for our 2019-2020 year. So we're really looking forward to that. We will be sending out e-blasts and emails about that, giving you all of the details, as well as you can find it on our website. So let's get started talking about health careers and the value of learning more about health careers to your students. I wanted to start with a poll question, so if you don't mind taking a moment to answer this. So we're wondering, is career development currently part of your curriculum, whether that's health careers or a different field of careers. So we'll give you just a moment to answer that. So people are still putting in, we're almost got everybody's vote. Nicole, you want to give us the results of that poll?
Yes, I will do that right now. Okay, so it looks like it's a 60% that yes, it is included but not a primary focus, and 33% yes, it is a significant focus. 7% no.
Okay, great. So I'm glad to see that for many of you, you are including some information on career development, as we know it's so important for our students. So today I want to kind of cover three basic areas, a little bit about career development and the benefits of taking a contextualized approach towards teaching students about career development and the skills that they need, as well as research skills to find out about different occupations and how to move forward in training or certification. I also want to talk a little bit about the job trends in the state of Florida as well as the United States. And then for the majority of our time today, we're going to really get into the Health Careers Guide and show you different ways and techniques and strategies that you can use to make it relevant and engaging for your students. So I think we can probably all agree that one of the primary motivators for our students who enroll in adult education is to be able to improve their skills in a variety of areas in order to be able to either find a job or be able to find what they consider to be a better job or a more skilled job. Sorry, my computer's lagging a little bit. So what we know by a report that was released by the state of Florida is that students who make learning gains have a better chance or a higher chance of improving their employment outcomes. And that makes perfect sense, right? Our students who have stronger math skills, stronger language skills, stronger reading skills, are going to see that directly related to their ability to become employed. About half of unemployed students who do show learning gains do subsequently find employment after completing or going through at least part of an adult education program. So we really want to tap into our students' motivation to get a better job, to help them be more engaged in the classroom and fuel their academic progress. So research also shows us that students that do have career goals have a higher success rate than students without goals. And then we see by integrating different topics into the curriculum, students can acquire their skills more quickly and often do so in a more enthusiastic way. So we've really kind of taken this concept of contextualized learning to the next level, I think, at FLC in terms of our publications and our webinars and our training, because we find that the research backs up this type of learning in which students can see relevant information, life skills being improved while they're also working on their basic, adult basic education skills. So when we're talking about focusing on student career development, we're talking about, again, focusing on math and numeracy, language, reading and writing skills, while also working on core job skills, thinking skills, especially critical thinking skills and reasoning skills, computer skills, communication skills, being able to communicate with customers or clients, answering the phone, answering emails. We all know that communication is such an important part of many of our jobs today. So a big question that I have is, do we feel that most adult education students can see education as an achievable path to their good job, whether that's adult education or post-secondary education? And if they don't see that, I think it's our job as educators to try to help them more clearly be able to visualize their path and to be able to visualize success. So I want to throw another poll at you. If you take just a moment to answer this. Do you think most of your students can see a clear path to good job opportunities with the continuation of their education? Okay, so just another moment. Okay, Nicole, you want to go ahead and close that poll? Let's see what our results are.
Sure. All right, so for this poll, it seems like 57% say yes, 36% say no, and 7% are not sure.
Okay. So I think that's good information for us to have on both sides. So 57% of you have students that are able to see that, and that's fantastic, and I would love to hear more. Maybe you can send us some comments of ways that you try to highlight that for your students so that they are able to visualize that success. And for those of us who are still working with students to see that, I think really beginning even with the beginning level students, beginning to talk about general career education and general skills, and then getting more specialized as we get to the higher level students can really be an effective mode. I'm always trying to talk about career development and job skills. So I imagine that most of you that work with students on a regular basis are familiar with the Florida Workforce Innovation Opportunity Act. I just wanted to bring it up because we have seen some good results, especially from CareerSource. 285,000 individuals who received services from CareerSource found jobs in 2017. So that's really an encouraging results of the opportunity that, especially in certain regions, that CareerSource is offering our students. And we will take a look at a few CareerSource websites in just a few moments, because with health careers being such a high demand field, we do see a lot of training for qualified students that can be paid for by the state. So that can be really useful for some of our students who have a lower income level. So I hope you're familiar with the CareerSource in your region, and each region determines what they consider to be these high demand jobs. And then also kind of part of Florida's support is Job Corps, which provides job training and housing and basically all life necessities for 16 to 24-year-olds that qualify. They have typically an apprentice as well as class-based training so that when students graduate, they are able to go directly into the workforce. So I pulled this from the CareerSource Central Florida site and just tried to target some of the healthcare jobs. Definitely there are other fields that are high demand as well. We decided to focus on health careers since it is such a growing field in the state of Florida for a number of reasons, which we'll talk about in a few moments, about our aging population, high number of retirees. So really healthcare is a great field, but also there's construction and other trades like plumbing and welding that also are high demand jobs. So I just pulled out a few of the offerings at Orange Technical College, which is a college that is close to FLC in Orlando, as well as Lake Technical College, which is a little bit closer to Tampa. So you can see the different columns. They have clock hours, which means how many hours of training, and that includes on-the-job training required. What is the maximum covered cost by CareerSource? And what is the total training cost? Can someone get a Pell Grant for that particular training if it's not completely covered? So let's just pull out maybe a few of these. For instance, we could look at medical assisting, and we're going to take a look at that in the job listings in just a moment. So that's a good one to choose. Medical assisting is about 1,300 hours. The maximum covered cost is $5,000. but the total training cost average in Florida for a public institution is $5,130. So there is a little bit of a gap there of $130 that the student would be responsible for, as well as sometimes there can be additional supplies. But what a great opportunity for someone who is looking for additional training and is not quite sure how to afford it. So I encourage you to take a look at the career source in your area to see what the high demand jobs are for you. So here's another one, Career Source of Southwest Florida. You can see the websites for the different regions look completely different, so you sometimes have to search a little bit to find these high demand jobs. I really like their website because they give us some additional information. So if I want to look, for instance, at dental assistant, I can see which locations will honor that career source funding for training. So that can really be useful for students too, to try to identify a program that's in their local area. So to access this, students need to visit a career source, meet with a career counselor, and they will determine whether they qualify and assist them with the next steps. All right. Another great resource from the state of Florida is Florida Shines. They do have a website specifically about pursuing a healthcare career as well as other high demand careers. So if anyone has any questions at this point so far, please feel free to send them in. We're going to kind of move to the next section, which is job trends. So if you look at this graphic on this title page, you can see some of the changes in the number of jobs in different fields. So the blue line indicates the number of jobs or employees in the manufacturing field. The red line indicates education and health services, specifically healthcare field, and then in green is retail trade. So we've had very significant changes in our country since the 1970s, and we can see the projection of healthcare jobs on this trajectory is only going to continue to grow as we see manufacturing jobs continue to decline, and we see retail jobs basically still on a slow decline or in a slow growth, just depending on the year, but definitely not growing at that rate as the healthcare jobs. So a study came out last year that I found pretty interesting that I just wanted to touch on for a few moments. And kind of the question that was being asked by a joint project between JP Morgan Chase and Georgetown Center on Education in the Workforce is, does a person need a bachelor's degree in order to get a good job? And we know that's something that we have heard when we look at statistics on earnings. We see that overall, through time, people who have bachelor's degrees tend to out-earn people with high school diplomas, and people with GEDs or high school diplomas out-earn people who do not have those credentials or those certifications. So this is kind of interesting. They define a good job for this particular research project as a job that pays $35,000 or more, that's $17 per hour for a full-time job for someone under the age of 45, and $45,000 a year, about $22 per hour for a full-time job for a worker over the age of 45. So in 2015, these good jobs had a median earning across our country of about $55,000 per year. So this map kind of shows us where are we seeing the most gains in these non-BA or non-bachelor degree jobs. We can see Florida is in the higher percent. We've seen gains of 20 to 50% between the years of 1991 and 2015. Getting more specific on what we see in Florida, who has the good jobs? 51% of people who meet that definition of a good job have a bachelor's degree, but 49% of workers who have that definition of a good job do not have a bachelor's degree. So that shows us that there is a lot of opportunity for our students, especially bilingual students, who most of our students are, or many of our students are, to be able to get good jobs. How big is the non-bachelor's degree workforce? We can see in that second graphic on the left, about 68% of all workers do not have a bachelor's degree. 30% of non-bachelor workers have what we defined as a good job. The The median earnings in Florida was about $54,000. And then you can kind of see the distribution here of people. So really what we're looking at is that link with training and post-secondary education, not necessarily a 4-year degree, but even 2 years or less can produce a good job that provides some security, some job security and benefits for our students. So as I've mentioned a couple of times, we're definitely seeing an explosion in growth of healthcare jobs in the US as well as I mentioned in Florida. It is the largest job sector now, projected to add nearly 4 million jobs by 2026. So this is the reason why FLC decided to kind of focus in on this industry. This is a listing of what they consider to be the high demand or the hot jobs, as they say in the state of Florida, and this is based on data from 2017. So again, we can see there's quite a bit of growth in the area of healthcare. So our top two are nurse practitioners and physician's assistants. That's not going to be less than 2 years, but we see quite a few of these are degree or certification programs that are 2 years or less. The physical therapist assistant, for example, the medical assistants, the cardiovascular technologists and technicians, dispensing opticians, the vet techs. So there's a lot of different types of programs for our students, not just clinical, but also working behind the scenes, working with animals. So at this point, I want to kind of get into the Health Careers Guide, show you how you could implement this with your students. And really, it kind of depends on the class. It could be done one-on-one. It can be done with a group. It can be done in one class period. It can be done in 4 class periods. So really, it depends on how intensive the instructor wants to get. We are going to talk about a research project that I feel is really beneficial in terms of really helping the students to first learn how to research about a career and then actually do the research on a career that they're interested in. So this, I'll get into the research project in just a couple of minutes, but it really hits on a lot of those basic skills that we're trying to help our students to become more comfortable with. So the highlights of this curriculum, it's just a general introduction to health careers. Obviously, we couldn't cover everything, so we really try to focus in on the high demand growth jobs in the state of Florida. The guide is written at a 5th grade level. There are some words that are higher than a 5th grade level. It was kind of hard to avoid when we're having some medical terminology, but if you look at the guide, you will find we define in a 5th grade level or less language each of the medical terms that we included, as well as we provide a glossary at the end of the guide. But if students are going to be entering this field, they do have to have some of those basic knowledge of some of those basic vocabulary words. So we did design this to be used online as an interactive book, and we'll go through it in just a few moments and you'll see why we've done it that way. But starting this summer, we do have print versions available. We realize that not every classroom and every tutor has access to the internet, so we are hoping that perhaps the print versions and the electronic versions can be used hand in hand, or students could use the electronic version on their own time to explore different jobs. We do have some spotlight pages that kind of really show what we call laddering opportunities for different fields. So we included 25 high demand jobs, as I mentioned, that require 2 years or less of training. So there is a teacher's guide that goes along with the Health Careers Guide, and we're going to take a look at both of those. So as I mentioned earlier with contextualized learning, and this is true of all of our Staying Healthy books, we can focus in on a specific topic without sacrificing our core goal, which is to help students to improve math skills, research skills, language skills, reading skills, communication skills. So if you give me just a moment, I'm going to bring these two up. And I'm kind of interested to see. So if you don't mind answering another poll question, I'd be interested to see how many of you have worked at all with this Health Careers Guide, or even if you and your tutors have taken a look at it. So if you could take a moment just to let me know if you've used it before. We're still got a few more results coming in. Nicole, you want to close that poll and we'll take a look at the results?
Sure. Okay, so it seems like 43% of you have used it and 57% have not.
Thanks. Great. So as we're going through this, if anyone has used it and has some comments or questions as we go along, we would love to hear from you as we talk about it. So this is freely available on our website. If you are in the state of Florida and you're in a literacy organization that serves adults, you can also request copies for your classroom at no charge. So for people who are in the state of Florida, this is a great, freely available resource for you. So on the left, we have the student version, and on the right, we have the teacher's guide. And I just wanted to kind of show you how they go along together and can really assist an instructor or tutor who might not have a lot of experience in health careers. But really, that's not necessary, as this is just an introduction. We really just want to encourage students to start to think about different careers, to talk about what their skills are, what skills they want to develop, and learn, as I said, those research skills. All right. So for the beginning, you can see we just provide a general overview. If you look at the teacher's guide, we try to highlight for you the key vocabulary that is included in each section. We do bold it in the student version, as I mentioned, and do have that glossary in the back. As I mentioned earlier, you can see at the bottom here, one of our major themes that we like to try to reiterate throughout teaching this curriculum is that training does equal higher pay and more career opportunities. So in the work that I have done with students, they're very interested in this whole laddering idea. And I really think that this can help our students who are struggling to visualize their career plan realize that they don't have to just jump in and do a long training program. Especially with a field like nursing, as it's illustrated here, there's a lot of smaller steps that can be taken to help somebody to go from a beginning level job to a highly skilled job. So I think it's important to explain to students what that means and how you can get on to the next step. So that climbing the ladder visual, I think is really useful for students. I did a presentation to a group of high school students at an at-risk high school in Orlando recently, and when they saw this Health Careers Guide, they just all ran for it because they said that they had heard and had considered how they could do training in smaller steps. So I was really encouraged to see students moving forward that way. So we do talk a little bit about skills, as I mentioned, like Career Shines and some of the other resources that Florida Department of Education as well as Career Development have put out, really get more into developing skills. But I think it's a great opportunity to speak with students about what skills they feel they have, what skills they feel like they need to improve on, and how to help them come up with a plan to improve those skills. So you can see over here in the teacher's guide, we give lots of different teaching tips, suggestions for how to start a discussion, as well as some activities that we'll see in just a moment. Understanding what a job pays seems to also be an area that we need to spend some time on, and that also helps us to get into math skills and numeracy skills. So for instance, we have a chart here about what is the median income or the median pay, excuse me, for a dental assistant. So that's a great opportunity to help your students to read a graph, to do some calculations, to understand what's starting pay and what's median pay. And all of the information on pay that we included in this guide was up to date as of 2017. We do realize it can change over time, but at least gives our students a good idea of what people in our state are being paid. Another good opportunity, I think, at this point is to even talk to students about how to read their paycheck. So this is Hands-On Banking, which is a program that is produced by Wells Fargo. It is freely available. But when students hear about how much they might get paid per hour, I think it's important to also help them realistically understand, and we all know this, don't we, that what we get paid per hour and what we see when we take our paycheck home can be a little bit different. So a great opportunity as well to talk with students about how do you read a paycheck, what taxes might be taken out, so they can have a realistic understanding if they're choosing a career and they're considering how much the pay is, they want to keep those factors in mind as well. And then we start to get into some of the types of training. And again, with the students that I've worked with, a lot of them don't quite understand the difference between a certificate, an associate's degree, which we also, in this publication, we call an A, but an AA, as well as a bachelor's degree. So to continue with our theme of the more training and education we get, the higher the wage, we did kind of put together a chart where you can kind of see what do you need for this particular position. Is it a certificate position or is it an associate degree required position? And again, that's the hourly pay in the state of Florida. And then we get into where we can get training. And I feel like this is also an area where you could really spend a lot of time with students to try to help them understand the difference between a county technical center, a private career technical center, a community and state college, and a four-year college and university. So at our Florida Literacy Conference last year, I talked with a group of adult education students about this. And many of them were already enrolled in a county technical program and still were unsure about these differences. So we really want to be careful with this because we know for some private institutions, they are charging an exorbitant amount of money for a certification that our students could be getting through CareerSource with a minimal tuition payment. So I think a lot of time can be spent in this area, and there's some really good resources to try to help with that. One would be the college scorecard. Oh, and that didn't come up. But the college scorecard, what it does is it tells you what's the graduation rate for a particular school, how much is the average tuition, so it can really provide a lot of good information for our students. We can also encourage students to check a school's accreditation. That has been a problem, especially with some of the private schools where they take a class and those credits do not transfer to state or county technical schools, or they complete a program and then they're not eligible to get a certification based on the education they got. So we really want to encourage students as well to research and investigate the program that they go into as much as possible. So again, we go page by page in this section to try to help teachers to have good discussions with their students on these topics and how to present it in a way that that is understandable. So the next section of the curriculum is what, when I've worked with students, is what they really want to get into. Well, first I'll show you here in the teacher's guide, we do have quite a few language building, vocabulary building activities, as well as one on how to choose a training program. Let's see if I can get that scorecard to work on this link. There we go. So this is the scorecard that I was talking about, where you can see what training is available in your particular area. So I could look at a two-year degree in health professions, and I can put in, for instance, I could just put in my zip code. And it will show me the different programs, as I mentioned, the average cost, the graduation rate, So it's a great way to compare different programs. I'll also later on show you some sites that tell you specifically for different degrees how much the average student pays to get that particular degree. But we can really see some differences in tuition amounts as well as graduation amounts for some of these different schools. So the next section I wanted to kind of talk about is the actual job section. So we broke the jobs into 4 different areas: patient care, health information, imaging and diagnostics, and administration. I found with the students that I've worked with that a lot of them, when we talk about jobs in the field of healthcare, they're thinking only of patient care. And while there's wonderful opportunities in that area, that's not going to fit the skills and career aspirations of all of our students. So I think going through the different areas of this guide can really help students to see that there is a very diverse job pool or number of jobs out there in the healthcare field, not just working directly with patients. So when you're navigating through the guide, we did try to color coordinate. So all the patient care jobs you can see are in purple. We try to provide a general skills checklist so students could kind of see whether their skills might match, different locations that they might work in. And then this page is really important, and I think you could spend a lot of time on to really make sure that students understand when they're looking at a job description or they're reading one of the job listings in this guide, that they understand what all these different terms mean. So we talk about the job title, and it can be kind of confusing because different organizations might refer to the same job with a different job description or job title. So we really want students to understand that when they're doing searches for jobs, they might have to use a variety of keywords. The next part are the duties. So we tried in 1 or 2 sentences just to kind of summarize the duties, to list how much or how long the average training is in the state of Florida, and whether it's a certificate or an associate degree program. The starting pay and the median pay, which they should understand from the earlier discussion of that in the guide. And next steps. We really felt this was important, again, to continue with that laddering idea of helping people see, okay, if I become a medical assistant, what could I do after that? So we tried to list at least one next step that a person could take if they wanted to continue their education. And then every job listing also has a Learn More button where they can get all kinds of information about that particular job. And then the little fire is just, is it a hot job? Is it a growing job in the state of Florida? So for the medical assistant, I'll click on the Learn More, and we have some wonderful resources that we link to. You can see there's a watch career video. It is at a 5th grade level, or almost all of them are, so they should be easily understandable, and most of them as well have subtitles to help students to follow along if they're still working on their English skills. So a lot of information about what a person in this position does, what would you do in a typical day, knowledge, skills, and abilities. So really helping students to get a better understanding of if they were in this job, what would it look like on a day-to-day basis? What's some of the technology or the software that they might have to learn how to use? What are some personal traits that would be beneficial in this job? What is the outlook? And I can check out the outlook in my state. I can also find training. So if I'm interested in being a medical assistant, I can put in my zip code, and it's going to tell me all the different institutions in my area that offer that degree. So as part of the research project, we're hoping that students will identify a job that they're interested in, find out what are the training options in their area, and then use those other tools that we looked at to research the institution, to find out the graduation rate, to find out whether CareerSource will help pay for the tuition. So all of these pieces can really fit together to help the student visualize their next steps in a post-secondary education. So again, the purple are all patient care. So physical therapy aid, personal care aid, home health aides. So these are kind of the basic, really entry-level jobs. You could see for a physical therapy aid, There might not even be any training required depending on the organization. So it's really good for students to at least have some CPR or basic life support training. And we'll talk about that in just a moment. Some adult education organizations have started offering those types of courses for students so that they have those when they go out to try to find a job. Personal care aid would be another one. Home health aid, some people can find a job where they get on-the-job training, or they can go through a class that's 2 to 4 weeks. Occupational therapy aid as well training is not required. So as you go through the book, you'll see more training being required for the different positions. A certified nursing assistant, 6 weeks, then licensed practical nurse, 11 to 13 months, and then registered nurse, 2.5 years. So that's kind of that laddering that I was referring to. And for some of these, you don't have to retake all of the classes. A lot of programs expect students to go through this program. So if you're a licensed practical nurse, it's not like you're starting over. You're just adding on courses to meet the requirements for the registered nurse. And you can go through and look at several other ones. We saw the physical therapy aide before. The next level would be that physical therapy assistant. The next area we got into is imaging and diagnostics. These do tend to take a little bit more training, so we're not going to see no training required or only a few weeks required, but these tend to be the higher paying jobs. I spoke with somebody who works for the Gulf Coast AHEC. She told me that many of these imaging and diagnostic jobs, at least in Southwest Florida, they're unable to fill them, so the salaries are really increasing as a result. So the same type of setup, a description of the job, training, starting pay, median pay, and then the ability for a student to learn more. And then we get into administrative and support services. You know, when you and I go to the doctor, we see a lot of people, and there's a lot of people involved in our care before we even get to see a doctor. So these are really important jobs that we can encourage our students to go after. 911 public safety telecommunicator or a 911 dispatcher. I know in Orange County where I live, they're always trying to hire 911 dispatchers, for instance. So again, we have some lower level positions that are more entry level, and then we have more that have certifications or associate's degree. But a patient transporter is a great way for a student to get into a hospital system, to start their career, and then they're able to ladder their way up once they have started in this position. A lot of students ask me about this medical interpreter position. It is a 40-hour training program that requires students to have pretty high skill level in both English and in another language. They do have to take complete tests to verify their level of understanding of the language. But AHEC and Gulf Coast, as I was just talking about, has been offering this online in the state of Florida, so students can actually do training in the evenings or whenever it's convenient for them, and be able to move forward in medical interpreting. And then health information and records. This is a very dynamic field right now, changing a lot as we have moved towards electronic medical records. Some of these training programs are available online and still fall under Career Sources tuition program. But medical coders and billers, electronic health record technicians, the more difficult program would be health informatics. And health informatics is a huge growing field. You can get, you can be a specialist, and you could go to a 2-year degree, a 4-year degree, master's, doctorate. I mean, there's a lot of work in informatics, because as all of our health information is now going to electronic systems, there's a lot of design that has to go behind those databases and those systems. So those are our four areas. So if anyone has any questions at this point, feel free to ask as we're kind of going through this. But that's the basic curriculum. So now I wanted to talk a little bit more about that teacher's guide. So as I mentioned earlier, we realize that not every student is going to have an opportunity to do a big research project, so we tried to break it down. I mentioned the How to Choose a Training program, where you encourage your students to find some schools in your area and do a little bit of research on them. We have some vocabulary pronunciation activities. But the activity 7 in our teacher's guide is that healthcare research project that we feel kind of brings together all the information that's covered in the curriculum, as well as a lot of the skills that were talked about. And this is a great opportunity for students to try to find a mentor or find someone in the community who has this job. Could they possibly do some job shadowing, or at least call a person and ask them some questions about what's a typical day like? What do you like about your job? What do you not like about your job? Where did you get your education? So it'd be really interesting for students to be able to reach out. Perhaps you could do this project as a group in your class and maybe invite someone from your community in to maybe talk about what it's like to have some of these different positions. Would also be really helpful. Through our health literacy program, we really encourage student field trips to medical facilities in order to improve their skills at communicating with doctors and being able to effectively access medical care. Another piece of that type of field trip or that experience could also be to learn more about those different positions. We also, in our health literacy program, have a lot of programs that do mock clinics within the classroom. That's another great opportunity to kind of meet several goals. The goal of a student understanding, again, how to access and communicate in a healthcare appointment environment, but also they can play different roles. The student can be the front desk person, the student can be the medical records, the doctor, the nurse, and they can kind of try on those different roles to begin to visualize themselves perhaps in pursuing a career in that area. So in the teacher's guide, there's a little article that was written by Julie Fault from Santa Fe Community College in Gainesville. They're doing some really innovative work in terms of contextualized learning with healthcare careers with their adult education students. So one thing that they decided to do, I think Julie herself became a certified basic life support instructor, and she teaches this to all of their adult education students. She found that this was a great way to kind of broach the topic of healthcare to begin with. They talk about the body, they work a lot on vocabulary, but then they also work on the skills of CPR and first aid. So since she's an instructor, she's able to teach it over a longer period of time. And she says that the satisfaction that her students get when they actually become certified is enormous, because some of these students, as you know, the same students that you work with, have never gotten a certification in anything, have never passed a test, or not for a very long time. So this can be a great confidence builder, as well as for people who want to work in the healthcare field. This is kind of a basic type of certification. So as I mentioned, we do have a health literacy grant program through FLC, where we're funded by Florida Blue Foundation, where we provide grants to 14 organizations every year. And these are the types of things that our grant program can pay for field trips, can pay for instructors to become certified teachers in this area, or can pay to bring instructors in to certify their students. In the last couple of years, almost all of our grantees have done some form of CPR training for their students, because they've gotten such positive feedback, and it gives them such confidence. But Santa Fe's done some other really interesting things as well. They work on the CNA program, which is Certified Nursing Assistant. They offer a pre-CNA class where they kind of prep students who are interested in the Certified Nursing Assistant certification. They give them kind of a prep class to get them ready to take it. And that has really improved the number of students who has successfully become certified. So I encourage you, if you're interested in kind of higher level contextualized learning, I would check out some of the things that they're doing at Santa Fe. So in the teacher's guide, I mean, we have a lot of resources for students, and then we added some additional resources for instructors, as well as other curriculums. So the thing that the publication that we put together here at FLC, we didn't see anything quite like it with the job descriptions, but there are some other really good resources in terms of educating our students. activities for our students. The San Francisco Welcome Back initiative, unfortunately, it went out of business, but its website is still up and it has a lot of great classroom activities, as does the Center for Rural Health from the University of North Dakota. Links, their healthcare career pathways has a lot of good resources. And I'm proud to announce that recently our Health Careers Guide has been included into that group of resources, but they have a lot of really good instructor support resources there as well. And we've been working somewhat with the Farm Workers Career Development organization as well. They have some great resources for students who live in rural areas and are farm workers. And then for our Teacher's Guide in the appendix, we have the activities that you can actually copy and distribute for your students. So just to go back to our PowerPoint. So I kind of covered that research project, and again, there's more information in the Teacher's Guide, but it really helps students to work collaboratively, to work together, to negotiate project duties, to do research together, with contextualized learning, taking the information we learn in class and then having the students on their own to really practice those skills in a real world environment has so many benefits to them in terms of confidence, in terms of them being able to integrate the skills and information that you've taught them into a level where they can be using it in everyday life. So again, here are those additional resources that I talked a little bit about, and some additional state of Florida resources. So I hope that this has given everyone a great overview of the curriculum and how to use it. I will show you on our website. If you go to Health Literacy Resources, it has all of the different Staying Healthy curriculum resources that we have, including the Health Careers Guide. We have an ebook, so students tend to like to look at this kind of as a flip chart or a flip book. So we have it in that form, as well as you can download a PDF, or we even have a printable form if you want to download it for your students. You can click here to go to the link to order copies, as I mentioned, if you are in the state of Florida, and also the Teacher's Guide is available here as well. And I'm sure many of you are already familiar with our other, as I mentioned earlier, Staying Healthy titles, which are freely downloadable as well at the site, as well as some basic health literacy videos that we've produced. So I'll give everyone just a moment if anyone has any follow-up questions or comments.
We actually do have a question here.
Okay. Sure.
All right. So the question is, how does a learner get started with getting CareerSource to cover part of a training program? The complaint we always hear from patrons is that when they go to the local CareerSource, they're sat in front of a computer by themselves. Most of these folks don't have basic computer skills or don't know what to ask for.
That is a great question, and I'm not sure if I can answer that. I would encourage you, if you do not feel at your particular office that CareerSource is meeting the needs of your student, I would encourage you to reach out to CareerSource to see if they can perhaps come to your organization. I do know that they have some kind of questionnaires that students do have to fill out in the beginning. So that's interesting feedback. I'll try to look more into how to do that, because students do have to go to the the CareerSource office, is my understanding, to begin the process. So I guess my recommendation is for instructors or tutors to try to form a relationship with that office to kind of smooth that pathway. But that's a very good question. If anyone else has had any experience with students going to CareerSource and can offer some suggestions, please go ahead and type those for us. But I think that's probably going to be your best bet, is for the teacher to reach out to CareerSource.
If I could just chime in for a second.
Sure.
The CareerSources also are pretty different by location, from what we understand. So depending on your location, you may have some issues that other, locations wouldn't have. If you don't feel comfortable yourself going and reaching out to a career source, a lot of times the people in your, the administrative office in your organization, or if you're in a smaller organization, a program manager, they usually can have a little bit more pull in talking to career sources. So if you feel uncomfortable going and talking to a career source yourself, definitely go to your program manager, especially if, it's a number of tutors who have this issue. I think bringing it up to your organization's program manager would be your best bet.
Great, thank you. I also did distribute one last poll for people to answer. I'd be really interested to know, in your opinion, what are some of the barriers that are preventing your students from transitioning to post-secondary education? So you can take a moment to answer that as we're kind of wrapping up. I think that can help us to develop additional resources for you to use with your students. Nicole, were there any other questions? Okay.
I'm sorry, I didn't realize I was on mute.
I said, are there any other questions?
Yes. So there are no other questions, but somebody did, on the content, somebody asked if this presentation will be available to access. So the answer to that is yes. We will be posting it on YouTube and on our regular website. It will be posted on our YouTube channel before it's posted on our website. So if you want to see it sooner, I would check out YouTube, our YouTube channel.
Okay, great. So I shared the results of that last poll question. It seems like all of these factors seem to be really important in terms of helping our students to try to overcome some barriers to move forward. So again, thank you very much to everyone for attending this webinar. If you have any individual questions about implementing this, I would be happy to work with you on an individual level. My contact information is on our website under staff, as well as it is at the end of this presentation, which, as Nicole said, will be posted shortly. So again, thank you everybody so much for attending, and I look forward to hearing your feedback on how implementing health careers with your students is received. Thanks so much.